Okay, so hello everyone and welcome to this focus group discussion. My name's Priya and I'm a researcher at the Heidelberg Institute of Global Health, and it's a pleasure to welcome you to this discussion. I will be moderating the discussion today, and to provide you with some context, this discussion will be part of a study that is looking to identify the barriers that women face in utilizing antenatal care services in different countries. So it's based on the 3 delays model, and we're specifically going to be looking at how delays in receiving care may affect women, and particularly focusing on antenatal care. So you should know that ethical approval has been received for this study, and we'll expect that it will take around 20 minutes, and we need to speak to each other in English. So this discussion will be recorded and notes will be taken as well. And our note taker is Rehana over there. Yeah. So the recordings will be destroyed as soon as this discussion is transcribed. And everything that you say in this discussion will be kept confidential and anonymous. If we choose to publish the information, it will be done so anonymously. So in order to maintain confidentiality, I also ask that you don't discuss anything of what we share outside of this room. Okay, so the last thing is that you need to know that your participation is voluntary, and if you decide not to participate, there are no consequences, and you can withdraw your participation at any time. So far, do you have any questions for me?
No.
Okay, so before we begin, there are a few basic rules that you need to keep in mind. You may speak freely about your ideas, but try not to interrupt anyone. Only one person should be talking at a time. There are no right or wrong answers, and although your opinions may differ, that's okay, but we just need to be respectful of everyone. So we also want you to speak clearly and slowly so that all of us can understand. So is there anything else at this point in time? Okay, let's begin the discussion. So to start off, I'd like us to go around and for each of you to introduce yourselves with your first name, your country, and one fact of why you think antenatal care is important. So we'll start with you.
Hello everyone, my name is Ted from Myanmar. Nice to meet you.
And also one short opinion that you have of why antenatal care is important.
Antenatal care is important because it can prevent maternal child death, and it can also identify the possible risk amongst mother and children.
Okay.
Hello everybody, my name is Rima, I come from Libya, and antenatal health care services are very important for the mother and the child. And assuring every lady access to antenatal care will prevent the risk of getting any complications or diseases maybe later on in her pregnancy, and ensuring a very healthy life for her and her baby.
Yeah. Thank you.
Hello everyone, I'm Eric, I'm from Kenya. Antenatal care is very important because when the mother is taken care of by the specialties or by the trained medical providers, all the eventualities, any risks are taken into account, and so any complications during delivery and after delivery are taken care of, and so the doctors are able to advise, and so the complications are not able to develop into the later years of life.
Okay, hello, I'm Mario, I'm from Yemen. I think antenatal care is a basic right for women to protect her from complications during delivery and reduce number of maternal deaths.
Hello, I'm Andres from Venezuela. I think that antenatal care is a powerful and instrumental tool of maternal mortality prevention.
Yeah. Hello, I'm Thomas from Ghana. I think the whole idea of an antenatal care is an initiation of care, or where we enroll the pregnant women, and then it sets up a stage of continuum of care from the history of the mother, how the baby is doing when she's going to deliver, and so on and so forth. So it helps us to also prevent any form of complication during childbirth. Yeah.
Great, thanks so much everyone. So I can see from your responses that you all have a good grasp of the importance of antenatal care and what exactly on the role that it plays. So, leading from this, I would like to know what challenges do women face in receiving antenatal care in your countries? And what we're really looking to know is from the perspective of women, what are the challenges that they face? So just to give you with some ideas, it could be waiting time, quality of service, infrastructures. Those are just some ideas. So would anyone like to go first?
Yeah, okay, I'll start first. Maybe during the current situation that the country is going on these days, unfunctioning health
In
facilities.
your country?
Yemen, yeah. So unfunctioning health facility and lack of medication, lack of workforce. So women, when she came to the health facility, she didn't find anything. So she preferred to stay in home better than goes to the health facility that just make her tired to go to the facility.
Right. Anyone else?
I would like to say is maternal education and knowledge also play a role, because like most of the rural women in my country, they didn't know that they should go to the health facility for antenatal care service as soon as they are pregnant.
Right.
So actually, adding on what Marwa said, the situation is quite close to each other, as we are also
In Libya.
Exactly, in Libya, we're facing a very bad political situation right now. So the security settings are also an issue. Deciding to go to an antenatal care service, I mean, you have to think twice before going there. So this could be also a restriction in actually deciding to go and access to an antenatal care service. Yeah.
And so say the women reach the healthcare facility, what are the issues that they face in receiving care?
Well, actually, the health system is running okay in this situation, but more or less the quality of the service is not like before. So it could be like she won't receive the same quality, and of course that will be also a barrier for other women deciding to go and accessing the service.
Right.
Yes.
Yeah.
Yeah, I think in my country the maternal services are actually free, but what's one of the barriers that come in is the out of pocket expenses. Like when a woman is going to access these services, there's the transportation involved. Yeah, the hidden costs, the transportation involved.
Right.
Maybe they have to spend on food on the way or something like this. So these are also some of the barriers that make the women not to access the ANC services.
Right. And once they actually reach the healthcare facilities, are there any barriers in receiving care?
Yeah, some women have the perception that the services are of low quality,
Okay.
and also some feel like the long waiting times at the facilities also make them not to feel like they need to access the services. Then some also feel like they're not handled well by the medical professionals, especially the nurses. Some of them talk to them like they're so rude, and then they feel like they're discouraged from accessing the services. Yes.
And which part of Kenya are you from?
I'm from Nyanza province, that is in Kisumu.
Okay.
Yes.
And the health system there is well developed? I mean, are there any differences within the country?
Yeah, there are differences, but there are some very remote areas which are also experiencing a lot of instabilities in terms of wars.
Right.
Yeah, so in these areas, they're very extreme, and I'm not taking them into account in this particular case.
Okay.
Yes.
Okay. Thank you so much.
Yeah, I will talk about cultural practices that limits the autonomy of women to seek medical care. In some jurisdictions, you have a situation where a woman needs to seek the consent of his husband, sometimes the in-law, before they initiate care. In this circumstance, if the in-law or the husband disagrees with the wife accessing medical care with respect to, the childbirth, it means the woman is not going to the clinic at all. So these are some of the things that are happening at the background, and it's difficult to identify until you get closer to the people.
So in Ghana, we also want to know, once, say, a husband gives his wife permission or the family is consenting and she reaches the healthcare facility, what are the barriers or issues that come up in receiving care or the quality of care? Could you comment on that?
Yeah, I think that access to healthcare has actually improved. And when it comes to difficulties in the health system arrangement, the only challenge may be the numbers. I mean, if you have a district hospital which is taking care of over 100,000 people, and you have a lot of pregnant women who are trying to access care within a very short time, there will be congestion, they'll have to wait, and there are some basic diagnostic procedures that may also not be available. So basically, these are some of the challenges. That is with numbers and even the healthcare professionals, the midwives who do the assessment, and then the medical doctors who also do further assessments. These are some of the systemic challenges that the pregnant women go through.
Okay. And is antenatal care free?
It is free as
Okay.
part of the maternal health care concept.
And
Okay,
Thomas, I
thank
would
you.
just like to, as you said, that there's an overload in some facilities. Is it because of the unequal distribution in the country of the health services, or is it because there is a shortage of the health services?
I think I'll look at it from the point of healthcare professionals. Of course, if you have a lot of pregnant women and you have a lot of professional staffs, you'll be able to match the gap. But you have a situation where you have about only 5 midwives in a facility. These midwives are supposed to run shift. So at every point in time, you have very little number or just few of them on duty. And the pregnant women, of course, they have to come. Yeah. So the facilities are available. We have CHIPS concepts that are helping to extend services to them, but it's about the number of professionals to deliver the care.
Thank you. Andres, would you like to say something?
Yes, in Venezuela, due to recent, from 10 years, collapse of the economy by economical and political reasons, most of the services has been gradually collapsing. But if I should mention certain barriers, some of them are structural. For example, in very indigenous areas of Venezuela, the barrier would be more regarding beliefs.
Okay.
But if you go to rural typical areas, not indigenous, they will have the problem of transport, and if it's worthwhile going to a preventive service as an antenatal care.
Right.
Then if you go into a urban center, you will have the issue of private, public, and a system which is completely fragmented, because there are 7 systems, and then you can go from one system to another according to the survival way is the
Right.
country after the economic collapse. They used to work reasonably well, boosted by the oil economy. Right now it's completely collapsed. But services can go very atypical, the referral. They are not linear or analogical. They are quite chaotical in the way they are. Yeah, and the barriers are more than cultural, is due to lack of service, lack of shortage of gasoline, or prioritizing some other survival ways, like looking for food rather than going into a preventive service.
Okay.
Yeah.
Thanks for sharing. It's interesting that you mentioned fragmentation. Does anyone else have that experience in their country within maybe private or public healthcare and different systems that are in place that maybe traditional forms of medicine wherein women would go for that rather than antenatal care in a hospital or facility setting?
Well, if I look at my country setting, access to antenatal care health services among pregnant women is quite high. We just have maybe few undocumented cases where pregnant women want to go and seek antenatal care from a herbalist or traditional person. Otherwise, most of the pregnant women in Ghana access public health services as far as pregnancy is concerned.
Okay, and can I ask how this has developed? Was there an effort on the part of the government? Was there a nationwide policy or program that encouraged women to come?
Yeah, if I do recall very well, I think in 2013, the government initiated a comprehensive maternal health care package, and that gave free access to pregnant women from pregnancy to childbirth. Everything is free. And with the evolution of the national health insurance, it's also helped to take care of some of the costs. So averagely, I think it doesn't cost so much for a pregnant woman to deliver in the healthcare facilities. Formerly, we had a situation whereby the midwives or the healthcare attendants will ask the mothers to come with baby cots, but the system has been streamlined in such a way that you don't demand anything from any pregnant woman who comes to deliver.
Right.
And I agree with Thomas. So in Libya, we have also the governmental health service absolutely free from the time you get pregnant to you get delivery. You deliver the baby. But Because of the, lack of motivation to the health workforce, most women are thinking now to shift to the private clinics so they can receive the high quality services, and maybe even because of the lack of the human resources in those governmental services, every woman chooses the best for her, so they decide now to shift to the private sectors more than the governmental.
Right.
Yeah.
It's also happened in Myanmar, like most of the urban people, they prefer to choose private settings, or maybe they would choose a specialist for their antenatal care service. In contrast, rural people, they are still going to get antenatal care service at the rural settings like midwifery care with midwives.
Okay, that's good. So
Maybe because they don't find a specialist in primary health centers, so they prefer to go to the private hospitals, because which is available in the health centers and health unit only midwives and nurses.
And is this the case in?
Yeah, it's the same thing. So they
But
prefer
I
to go to
think
the
in
private.
urban setting, they can access to like primary health care as well as the tertiary health care, but they rather to choose like advanced care at the beginning of the pregnancy.
situation.
Yeah.
Yeah, I'm with Titik. As the same situation in my country, the doctor can work in both sectors, governmental or private sector, but the level of performance is actually different, and that's because of the lack of the motivation. So when he receives, his money every month from the private sector, then he's very well motivated, and the quality of the service will actually be different. And that's why the women tend to seek the same doctor, but in his private sector more than the governmental.
Right, thanks. So we've heard information about Libya. Anyone else?
Yeah, maybe we missed one point. That's like geographical setting between urban and rural area, it differs. For example, in my country, like which is mountains and natural, people suffer a lot.
Right.
People they can able to access the health facility.
Right. Yeah, that's an important point, how women actually can access healthcare facilities. So I think we have to conclude the discussion now. It's been a pleasure, and the inputs and information that you have provided will be extremely valuable to our study. I'd just like to let you guys know again that everything you say will remain confidential and anonymous, and the recordings will be destroyed as soon as they are transcribed. And yeah, so all that remains is I will try to summarize the main points, and please let me know after you'd like to add anything, that in areas of conflict and political instability where countries are shut down on some level and the health systems are suffering, this is a huge reason why antenatal care services are affected. However, in other countries such as Kenya and Ghana, there have been national policies or programs. Antenatal care is free and part of a comprehensive package, and that's why women go frequently for antenatal care. And in Myanmar, as you said, there's differences between urban and rural, and I think many of you mentioned fragmentation of the health system too. So it's been great. So does anyone have anything to add on to that? Okay.
Thank you.
Thank you.
you
That's
so
the
much.
case. We can
Yeah.
end this. Thank
Thank
you.
Thank you.
Thank you.